Hello everyone, my name is Dr. Kasturi Baruah, Medical Oncology Consultant working at MOC Mumbai. In our homes, women take care of everyone, children, parents and families. But what they often do is to forget themselves. So today I want to talk about a cancer which can be detected early, is highly preventable, and that is known as CS cervix. However, it still continues to take thousands of lives in our country every year. So now we'll discuss what is cervical cancer. So cervical cancer is a cancer of the uterus. It essentially arises from the lower part of the uterus. So these are the few factors which may increase the risk of CS cervix. Number 1, infection with the human papilloma virus. A presence of immune deficiency in the patient. Presence of other sexually transmitted infections, for example, the genital herpes, infection like HIV, use of oral contraceptives, use of tobacco and any use of smoking, multiple sexual partners, and any exposure to DES, diethylstilbestrol. So can we prevent cervical cancer? The answer is yes. Number 1, quit smoking. Number 2, one should engage in safer sexual intercourse. Number 3, human papilloma virus vaccination. A simple vaccination can protect our daughters, our sisters, our mothers, our grandparents. So is screening important? A frequently asked question. My answer is yes. Screening helps us detect cancers at early stages. And how do we do a screening? Number 1, with the use of HPV testing. Number 2, with the help of visual inspection using acetic acid. And number 3, with the use of pap smear testing. So now let's talk about the signs and symptoms of cervical cancer. So my first taker is listen to your body. Abnormal bleeding, any unusual discharge, any pain in the lower back, these can be signs. So these signs should not be hidden but rather shared. Seeking help early is an act of courage and not an act of shame. Now, how can we diagnose a case of CS cervix? Number 1, we need to go ahead with a bimanual pelvic examination and sterile speculum examination, colposcopy or colposcopy guided biopsy. To know the stage of the disease, one needs to know local extent and the distant extent with the help of local imaging in the form of CT scan and distant imaging in the form of PET CT scans. So advanced cancers of the cervix can be treated using concurrent chemoradiation. What chemotherapy does essentially is to increase the sensitivity of radiation. In patients who have distant spread disease from the CS cervix, what is the ideal therapy is either chemotherapy or combination of chemotherapy with immunotherapy and targeted therapy. So now let's talk about the do's and don'ts of treatment and during treatment. Now coming to the do's, maintain a healthy, nutritious diet, do exercise regularly, and engage with emotional support groups. Don'ts, don't miss your doctor visits and avoid processed meats. After treatment, many women face with depression, anxiety, mood swings, early menopause. We have to be empathetic towards them. We need to give them a supportive world where they can openly express themselves so that healing can start, because we know healing takes time. Talk openly about women's health. Protect our daughters with vaccination. Protect our mothers and sisters using timely screening. A healthy woman means a healthy family and a stronger India.